For the second year in a row, Catholic Health Services has been named one of the best places to work in healthcare. Joining us via Skype to talk about that is Lisa Moller, the Vice President of HR Operations for CHS. And you're named by the Modern Healthcare and CHS, the only provider in New York State to make the list. And that's not all. 2018, 2019, you were also named the top workplace by Newsday. So what makes CHS one of the best places to work?
Well, Colleen, thank you for having us here today. Really proud of this accomplishment. I think particularly proud of being named one of the only New York providers on Modern Healthcare's list. The thing that makes Catholic Health Services special really is pride in our organization, pride in our mission, pride in our values. And we hear that over and over again by our employees through all the different surveys that we have, including our annual engagement survey, Newsday, and Modern Healthcare. And when we chose Modern Healthcare, we chose it because it was national. And it was a way for us to benchmark ourselves against other healthcare organizations throughout the nation.
When you talk about the surveys, actually the recognition is in part determined by employee surveys, and you have 18,000 employees filling out these surveys.
Right. The survey is actually sent to a randomly selected number of employees throughout the organization. And this year, the survey was released in June. And as you remember, June was a time when New York was just starting to subside from the crisis of the COVID-19 pandemic. So we really weren't sure how much response we would even get from our employees who were still struggling with the challenges of COVID-19. So to be named as a best place to work this year was tremendously humbling to us, because it showed us that not only would our employees take the time to fill out the survey, but their positive response about the organization showed us that they really did recognize the fact that we supported them throughout the entire crisis.
Yeah, that, like you said, the spring was just so challenging here.
Yeah.
CHS obviously working, and how do you work to have that right relationship and respect between employers and employees?
I think mostly by listening to our employees. You know, that's what's important, and that's why we take pride in these surveys, because it gives us that opportunity to listen to what our employees want and to take action.
Is there something
for example,
I'm sorry, Lisa, is there something that really stands out on these surveys that employees seem to repeat about why they like to work in CHS, with CHS?
There is. The common themes are respect, mission. It's a family organization. I think, you know, if I may, I'll recite one of the quotes that we had, because I mean, I think it really does say it all. The quote is, "It is a culture whose mission has patients at the center, with our Catholic values as the anchor." And I think that quote really does say it all. That is the overall theme. It's mission, value, family, and just being a best place to work.
Now, for people who don't live on Long Island and don't know exactly what Catholic Health Services, it's the system. It has 6 hospitals, 3 nursing homes, a nursing home service, hospice, and like I said, up to 18,000 employees. It is a big operation.
Yes, that it is. We really cover the whole life cycle of the patient.
And you're always looking for new employees, right?
We are always looking for new employees, particularly on the specialty side, always looking for specialty nurses, physicians. Laboratory technologists are one of our big areas that we are challenged with. And then really from the back office, our support line staff, I mean, we have just about every kind of opportunity you could be looking for.
And I have to say, your website makes it pretty easy to look for a job if anybody is interested.
Yeah.
Thank you, Lisa.
Thank you. Thank you for having us, Colleen.
And congratulations again. We'll have more CFN Live right after these messages.